We have a problem, and I need your help. In April of 2014, I was running a mental health clinic in Sumter when I got a call from the director of the South Carolina Department of Corrections. He asked me to come over to Columbia to discuss a few issues. I don't know about you, but getting a call from a prison to come down and discuss a few issues, that wasn't on the top of my to-do list. I was curious, so I went down to speak with the director, and he told me about this decade-long class action lawsuit and the challenges he had with treating the mentally ill. He asked me if I would consider leading his healthcare team, and he gave me this 50-page document. When I left that meeting, I was curious. When I finished reading this, I was changed. I read about a 27-year-old mentally ill inmate who was in solitary confinement for 6 years because she cussed out and threatened staff and inmates because they teased her for wearing diapers due to a medical condition. But what turned my stomach and made me really angry was when I read about Jerome Lightman. Jerome was a mentally retarded schizophrenic man who was left to die naked on a cold concrete floor. When they found him, he was lying in a pool of his own feces and vomit, and he was surrounded by 15 to 20 trays of moldy food. He hadn't had his medicine in days. He smelled so bad that the staff refused to go help him, and they ordered inmates to pull him out of the cell so he can go to the hospital. Jerome died later that day of a heart attack and hypothermia. I was enraged, and I knew I needed to do something. You may be thinking, I know you're upset, but who are you, and why did they call you in the first place? Well, I'm a retired Command Chief Master Sergeant in the United States Air Force, and I was a security policeman for 11 years. I've been in the mental health field since the early 90s. I was the superintendent of several military hospitals, both stateside and overseas, in peacetime and in war. Based on my resume and experience, they thought I was the perfect person for this job. They were absolutely wrong. You see, it didn't matter how motivated I was. It didn't even matter how much we wanted to fix the system. The bottom line is we needed to identify and divert the mentally ill from coming to prison in the first place. And for the people who were already there, we needed to treat them and help them transition out into the community. I learned 3 things pretty quick in the prison. That many of the mentally ill were there because they couldn't get treatment in the community. That prison is a horrible place to try to treat someone with a serious mental illness. And that without support when they left prison, many would be right back. We knew that there were a lot of good programs around the country, but we weren't using them very well. You see, the biggest gap in life isn't between what we know and don't know. It's what we know and we don't do. I'm convinced that there are 3 programs that we can expand today that will correct corrections, especially when it comes to the mentally ill. First, one of the best programs in the country is the Crisis Intervention Team, CIT. CITs were developed in Memphis after a mentally ill man was killed by police after they responded to a call for help. At that time, law enforcement didn't know how to deal with the mentally ill. Imagine arriving to a situation and a person is yelling, aggressive, and out of control. You have a split second to make a life or death decision. But consider you're scared and confused and your mind's not working quite right and there are people with guns yelling at you. That's a dangerous combination. With crisis intervention training, law enforcement learned how to recognize the signs and symptoms of mental distress and how to de-escalate a crisis to prevent injuries to them and the people they've come in contact with. If you've been watching the news, there's been a lot of focus on police shootings. Nearly half of those shootings has involved a person with a mental illness. Crisis intervention has been successful in reducing injuries to law enforcement and the mentally ill by as much as 80%, but only a small number are trained in crisis intervention. We need to change that. Second, diverting the mentally ill from jails and prisons using mental health courts have also been very effective. People that go to mental health courts have completed misdemeanors or nonviolent felonies like public intoxication and trespassing, and mental illness is their primary issue. So instead of going to jail, they go to a 6 to 12-month treatment program. Judges use a combination of praise and sanctions to help them to succeed and to fix their issues with mental illness. In areas like Miami and San Antonio, who have large and well-funded programs, they save millions of dollars and hundreds of lives since they began. We have a great opportunity here in South Carolina because of the 46 counties, only 6 use mental health courts. Third and finally, jails and prisons have become the new asylums. There are 10 times more mentally ill people incarcerated than there are in psychiatric hospitals. On top of that, 90% of the people who are incarcerated will be released in 5 years, and they'll be coming right back to our communities. If they're mentally ill and they don't get treatment, they'll be right back in prison. To fix that, we need to expand our reentry programs and to provide a warm handoff with our community mental health centers, provide enough medicine to bridge the gap between when they leave prison and when they get help in the community. Right now, when a person leaves prison, they get 5 days of medicine and a 30-day prescription. It takes 6 weeks to get an appointment with a mental health provider. Many don't make that connection, and they end up falling through the cracks. But sometimes things work out. This is Michael. Michael has suffered with mental illness since he was a little boy. At 17, he was arrested and went to jail for 3 years until he was released under the youthful offender program. He didn't do very well after he got out and ended up homeless, sleeping on park benches. But that wasn't the end of Michael's story. Michael met a new parole officer by the name of Tony Garcia and entered an intensive supervision program. That, with the help of a Greenville rescue mission, he got back into treatment and started taking his medicine like he was supposed to. Housing, treatment, medication, and people who cared made a difference in his life. Based on that great support and Michael's hard work, he was nominated and received an award for excellence by the governor earlier this year. That is a far cry from where he would have ended up without that support. I'm convinced that one of the reasons we find ourselves where we are is that most people don't want to spend money on criminals, and the mentally ill, they're invisible to us. What would you do if you had to make a decision between spending money on children, senior citizens, or inmates? Be honest, which would you choose? The truth is, we're paying, and we're paying big. Treating the mentally ill in the community costs us between $8,000 and $10,000 a year. Treating that same person in jails and prison, $30,000 to $40,000 a year. That's a classic case of pay me now or pay me a whole lot more later. When I started this talk, I asked for your help, and here's how you can help me. Tell your elected officials that treating the mentally ill is important to you. Tell them to fund crisis intervention training for our law enforcement and support mental health court. Tell them to fund reentry programs for our returning citizens, because if not, a third will end up back in prison. I'm convinced that if we identify the people that need help, treat them in the community versus jails and prisons, and ensure that they properly integrate back in the community, we'll save money, reduce suffering, and most importantly, save lives. With your help, we can correct corrections. Will you help me?